Today, I have with me two docs who are going to talk to us about sleep. I have Dr. Alana Biggers, who's an internist and an assistant professor of medicine at the University of Illinois Chicago College of Medicine. She currently has an NIH grant for research to study diabetes and sleep in African American communities. And we also have Dr. Nathan Lott, who practices pulmonary, which is a lung specialist, and critical care, like in the ICU, as well as sleep medicine in Waco, Texas. So thank you guys for joining me today.
Yes,
Welcome.
thank you for having us here.
So is it safe to say that most people don't get enough good quality sleep? And if so, why does that happen?
Well, they say actually over a third of Americans don't get enough sleep. And so getting enough sleep, what does that actually mean? That means getting less than 6 hours of sleep a day. About 45% of African Americans are not getting enough sleep, and it kind of varies between other communities as well.
Very true. The amount of sleep that people get is not always adequate, and there are a lot of different reasons for that. Some of it is, socioeconomic status. You're dealing with people who have to work very long hours and may have a really short amount of time to decompress after a day's work. You also have family responsibilities, kids, spouses, where that can kind of eat into that time. The other difficulty with quality of sleep is screen time. A lot of TVs in bedrooms, cell phones, which are much more portable than the old phones that we all used to have when we were younger, and the invasion of those into that area where you're supposed to get that quality sleep.
Yeah, and I'm just going to piggyback off of that and add to it. Many people are shift workers as well. So, they're not doing that 9 to 5. They're working, second shift or even third shift overnight, and that can really take havoc on their sleep as well. A lot of people who are shift workers really need to come up with a plan to try to help themselves get better sleep. To add to what Dr. Nate said about screen time too, is that blue light that people get exposed to from the screens that is actually messing with people's circadian rhythms, and then allowing them or making it difficult for them to sleep.
So what's the price? If people aren't getting enough good sleep, what does that do for them? Like, obviously, if you don't sleep well at night, you'll be sleepy during the day and you have to drink a lot of coffee, things like that. But is there a bigger health benefit or health cost if you're not getting enough sleep?
Yeah, absolutely. Not having enough sleep increase your risk for a lot of things. One thing I study is increased risk for diabetes and cardiovascular disease as well, or heart disease. Also, there's an increased risk for Alzheimer's or accidents. Even they see people who don't get enough sleep are more likely to have depression, anxiety, those types of things. So lots of health consequences.
Yes, sleep deprivation is a prominent presentation for many patients that have sleep apnea. And there are other um, parasomnias and other sleep disorders that can also be manifested due to the lack of sleep. Ultimately, when you look at it from a sleep apnea standpoint, there are other cardiovascular risk factors like heart attacks, strokes, heart failure that can be worsened if sleep apnea in that population isn't treated.
Yeah, and having poor sleep actually can increase your risk of developing diabetes. And if you have diabetes, having worsening diabetes. So your blood sugars are just not well controlled at all.
But what about those people that say, "Oh, I don't need a lot of sleep. I sleep 3 hours. I'm back up on my feet. I'm good. I'm energetic. I work two jobs and I'm on the go. I'll sleep when I'm dead." What about those people? Like, are they just an anomaly? Do they really not need that much sleep? Like, what's going on with that?
I would say that there is an optimal amount of sleep that every person has. However, the body is really good at adapting to abnormal patterns. And that is something that we have all instinctively done for various reasons over the course of our lives, studying for this exam. So you just kind of put off that extra sleep. Um, when you stub a toe, it hurts. What do? You alter how you walk so that it doesn't hurt as much. If you fracture a rib, you don't breathe deep because it hurts. So you do whatever you can to kind of coddle that. And your body just adapts to that. And in some cases, it can be a maladaptive or a poor response to, or a poor adaptation to that change in what's supposed to be normal. And that maladaptation can over time cause problems.
So pretty much you're saying that that person is just doesn't feel his or her sleep deprivation as much as maybe they would have in the beginning, but they still need that sleep.
Yeah, they need that sleep and it's going to catch up to them. I've had plenty of people who said, Doc, I used to be able to sleep, like you said, 3-4 hours, and now I just feel really tired and I just don't feel like myself. Eventually it will catch up to you.
In the setting of sleep apnea, I have plenty of patients who say to me, I didn't have any problems until they're treated for their sleep apnea. And then they're like,
whoa.
Wow.
Yeah.
Whew, I did not realize I wasn't sleeping well. And it's
Yeah.
because you adapt to to the lack of sleep. Maybe not well, just enough to get through, but it's not a healthy adaptation.
Yeah.
So there are a lot of reasons, right, why people don't get good sleep. Like you guys mentioned some of the things with the phones and the screens, but like you said, there's other health conditions that can play a role. So if you're someone that either you're not sleeping, you're not getting 6 hours of sleep a night, or let's say you are getting 8 hours of sleep and you're still waking up exhausted, like where does that person start? Like how can they find out, do I have a sleep disorder? Do I have sleep apnea? Do I just need more than 8 hours? Like where do they start? Because there's so many different things that overlie sleep. So
yeah, first I just want to add though that the optimal sleep range is between 7 and 9 hours. So try to make that your goal. In terms of where to start, I would say talk to your primary care physician. Say, hey, I'm sleeping, or at least I think I'm getting this amount of sleep, and I'm waking up, I'm tired. I hear myself snoring. Sometimes I wake up with snoring, or my significant other is telling me, hey, you weren't breathing last night, or saying that they were snoring, etc. Because then we can refer you to someone like Dr. Nathan here, and get a sleep study. And that's where I would start, talking to your primary care physician, and then seeing whether or not you need a referral to a sleep specialist.
Some people get the referral post or peri-procedurally. So they're having some type of surgical procedure, and you'll have the nurse anesthetist, or an anesthesiologist, or an internist who will do a preoperative evaluation and do a scale called a stop bang, which is used as a way to assess what are the risk factors that this person has from a symptom standpoint that put them at risk for sleep apnea. If you hit a certain number, then they'll say, well, you should see someone to get yourself evaluated for sleep apnea.
and those are things like being overweight, right? What are some of the other risk factors that somebody might start to think maybe I'm at risk for sleep apnea?
Obesity is a large risk factor. However, in America, somewhere between 40% of patients with sleep apnea are not overweight. So a not insignificant number of people may not be, the chubby, or rotund, or pleasantly plump. They can look, nice, skinny, and you think, oh, it's fine, but they can certainly have sleep apnea. Some of the other symptoms that people will complain of are excessive sleepiness. So, you have that morning, you wake up, you're like, oh, another day. instead of, nice and perky and ready to get the day started, that tiredness, that feeling like you just can't get enough sleep.
Mhm.
Morning headaches is another common symptom that patients complain of that have uncontrolled sleep apnea. Uncontrolled high blood pressure is another process that can be precipitated by sleep apnea. Last I was reading, it's the average American that's being treated for high blood pressure requires like 3.5 pills for treatment. And uncontrolled hypertension can be exacerbated by sleep apnea, such that treatment can help to improve control for their sleep.
Wow. So let's go back a little bit. So we've checked off sleep apnea. We got that. What about the other things that cause people to not have good sleep at night? You mentioned the screen time. Let's talk about that. So is there some sort of measure, like if I want to fall asleep by 11, do I stop looking at the screens at what time? 8, 9, 10? Like, is there a rule on when to shut it down? Or is it just when you're looking at a screen a lot throughout the day, it like adds up? Like, how do you assess that? And how can you set yourself up for a good night of sleep?
Yeah, but well, the recommendation is for you to stop looking at screens, whether it is your TV, or whether it's a tablet, your phone, about 2 to 3 hours before you go to bed. So really, you can wind down because I mentioned before that the blue light it suppresses your melatonin levels, and your melatonin actually helps to make you sleepy. So it gets you into that state of sleep. And if it's those levels are suppressed, then it's harder for you to go to sleep. So really kind of shutting it down, I would say at least 2 hours before going to bed, and doing something that's more relaxing, whether it's reading a book, taking a shower, even meditating, then that would be very helpful.
Yeah. So what about the people who fall asleep in front of the TV, or they fall asleep with the TV on in their bedroom because they feel like it helps them fall asleep, and then it plays throughout the night? What's the deal with that? Are they getting good sleep? Is it really helping them fall asleep? How does that work?
Well, when the TV is on, it is still emitting the light. So the brain still senses there's light in the area, and that may contribute to suboptimal sleep because instead of your body going into that deeper level of, knowing that it's nighttime, knowing that it's sleep, there's that light that's still going and that's flashing that you still sense through the closed eyelids. So it can still contribute to the sensation that, hey, daylight is coming, or daylight is coming, and making you less likely to get the optimal sleep that you think you are.
Mhm.
Many times, though, it's not the light that people are searching for. They just want some kind of soft noise to uh, help lull them to sleep, in which case a white noise generator, or if you have a Google uh, device or YouTube, there are certain videos that are dark screened where you can let it play all night long. That'll give you that sound that you're searching for without the light.
What about the sound though? The sound doesn't disrupt sleep?
Not to the extent that light does.
Mhm.
Good to know. Good to know. So speaking of the levels of sleep, so I have my Garmin, right? And so every night when I sleep with it, I wake up the next day, it tells me how long I've slept, it tells me how many times I moved, it tells me how much time I've been in REM or REM sleep. I'm sure there's other folks that look at that and they're just like, what do I do with this information? So talk to me about REM sleep, how much you want to get. If you slept 8 hours, how much REM are you supposed to be aiming for? If you've had no REM sleep, what does that mean? Because we're all getting all this data now from all these devices that are attached to us. So help folks figure out what all this stuff means.
Well, there are 4 stages of sleep. The way that I'll describe it in my office: stage 1, stage 2, stage 3, and REM sleep. REM being the deepest level of sleep. Um, in general, you sleep in a not constant level at one speed, but you kind of cycle between those different stages over the course of the night. It's roughly every 60 to 90 minutes is when you cycle from the higher stages down into REM and then kind of back up. And that happens pretty regularly during the course of the evening while you're sleeping. As the night progresses, the time in REMs gets longer. And I forget the number, but it's over 30% of the night is typically spent in REM.
So is there a way, well, first, let me start over. Is there a benefit to REM sleep over the different phases of sleep?
So REM sleep is the restorative sleep. This is the rapid eye movement, the
Mhm.
time when you're sleeping where your body is, for lack of a better term, replenishing itself from the day's activities and things that you've kind of gone through over the course of the day. You don't really control whether you get into REM sleep or not. It's just kind of controlled by your body and your own rhythm. So, um, children, actually, I'll take that back because I don't do a lot of pediatric sleep. And I'll just kind of leave that alone. But adults get, decent REM sleep if you have good sleep hygiene.
And by that, you mean the stuff that you've been talking about with the screen, how you
Decrease
fall asleep?
screen time, trying to not be overly stimulated right before
Mhm.
you go to bed, doing things that help to promote relaxation in whatever form that is for you, and those types of things.
Yeah, keeping the room dark, keeping the room, they say cooler. So the room being too cold, of course, if that's not comfortable to sleep, or too hot, that's not comfortable either. But so anywhere between, they recommend 68 to 72, but I think that it depends on the person as well. So, but generally around that temperature, people are more relaxed and can sleep better.
Cool. And so let's talk about sleep aids. A lot of people, I myself, I use melatonin when I can't sleep, to kind of give me that, especially if I'm shifting the hours that I normally would sleep, like back when I used to work nights for sure, I would use some melatonin. But then there's also prescription ones, right? Like Ambien and things like that. So when does somebody need those things versus just changing lifestyle?
I would say let's try lifestyle first. always see, I always try to talk to my patients and see, what's going on in their lives. If they're even having stressful events in their lives, that can completely knock off your sleep cycle as well. So talk about whether or not they're stressed, talk about their environment that they're in, where their room, is it comfortable? Do they feel safe? All of those things. And if that's off, or their screen time, etc., then we talk about how can we optimize that first before we start discussing medications.
The first order of sleep is sleep hygiene.
Mhm.
Just like you brush your teeth, you take care of your personal hygiene to get you through the rest of the day. You need good hygiene to help you go to bed as well. So, doing the things that we talked about are how you give yourself good sleep hygiene. Medications are utilized to assist in getting there, and there's maintenance, staying asleep, and then induction or having a problem getting to sleep.
Mhm.
Those are the two types of insomnias that we're kind of getting at. Melatonin is really relatively good at helping to what we call drag you towards the sleep cycle when you take it. So I look at it like a magnet. If you take it at the end of the evening, it's going to drag your sleep cycle towards that. If you take it in the morning, it's going to drag your sleep cycle, towards that morning time. So it's important to be, if you're going to use it, try to be consistent in it, and try not to, overdose on it. You don't need 20 to 40 milligrams of melatonin. Need that much, you probably need to see someone about
Right. What about like the glass of wine that people will do at night to wind down? Does that actually give them good sleep, or is it working against them?
It's actually working against them. That can also, people feel relaxed and they feel sleepy. But I don't know if you notice, or it happens to me. If I have a glass of wine, I will wake up in the middle of the night. So it actually messes with your sleep cycle as well, and gets it out of rhythm. So it's, though some people think it helps them fall asleep, it actually is not doing that good of a job.
You may fall asleep with it,
Yeah.
but it doesn't keep you there.
Yes.
Right. Fall asleep wherever you are.
Wherever you may be using
That is
in
very true.
excess.
Very true.
Fair enough. And then I also wanted to touch on exercise. What role does exercise play in getting good sleep? Particularly, does it help you fall asleep? Are there certain times a day you should exercise so that you can fall asleep? What's the word on that?
I think exercise is very important in trying to encourage you getting to sleep. And the reason why, when you are, more fit, you're able to kind of lose a little extra weight. It helps to increase, in some people, it makes them a little more tired or a little more exhausted at the end of the day. So they're able to feel like they've been accomplished, and then they can, sleep more fitfully because they feel accomplished, feel like I've done something. So I feel that exercise is a very important aspect, and not just from a direct impact on sleep, but indirectly through through how you feel about yourself, and how your health benefits from exercise.
Yeah, I agree 100%. And then one of the things with someone is diagnosed with obstructive sleep apnea, we tell them, you know, hey, exercise and lose some weight. So that will actually help with the symptoms of obstructive sleep apnea too.
Awesome. Now, what about someone, say a new mom or new dad, or somebody who can't always sleep 8 whole hours straight? You read some things that say, you can't make up sleep. People will say, oh, I can't sleep during the week, but I'll sleep during the weekends a little extra. So I guess let's try to myth bust a little bit. So can you ever make up sleep? If you did, 8 naps an hour each, does that equal a night of 8 hours of sleep? Like, how does that work?
No, it doesn't quite work out that way. And the reason why is because of the cycle that we spoke about earlier. So you have to get into those deeper levels of sleep to get the restoration that you're looking for. So 8 1-hour naps isn't that 60 to 90-minute cycle of sleep that you need to get into that deeper levels of sleep. Now, can you catch up to sleep? Yes, and it's a phenomenon that we usually see in patients that are treated with sleep apnea. So when a person has OSA and they've dealt with it for years, and they finally come in to see me and I complete the workup, yes, you have it. We'll start you on therapy with some type of positive pressure device. When you wear the mask, for that first 3 to 6 months, I often tell patients, you're probably not going to feel great for the first 3 to 6 months. It's not that the machine isn't working,
Hmm.
it's because you are. Your body is trying to catch up on all that lost REM sleep. It's a phenomenon called rebound REM. And what happens is, because you're finally able to sleep, you're finally able to rest, your body's no longer trying to keep you from falling into that deep level of sleep because it can allow you to. You fall into that REM level much quicker, and you stay in it a lot longer over the course of that 3 to 6 month period. So some people, I tell them, it can be 6 months before you really start to feel like you're getting that extra sleep, and that's because you're in that deeper level of sleep for a lot longer, and your body's rebounding from all the lost sleep you haven't had.
So when we talk about sleep apnea, and you mentioned one of the treatments, so just so that we're clear, so one of the treatments, or the main treatment for sleep apnea, right, is a machine that people have to wear at night. I'm sure you've treated tons of patients with this. How do they feel about wearing a machine or a mask, or sometimes it can go in your nose? Like, Is that a hard sell? How do you convince them to do it? You know, I've heard personally some patients that know they have sleep apnea, know they need the machine, don't want to do it, don't want to have that going. They feel like maybe it will affect the closeness that they have with their partner when they sleep, that they'll be kind of trapped to a machine they can't toss and turn the way they normally would. So what do you say to the patients to get them to really understand the importance of using it?
One of the first things I ask is, you know, if they've even tried the machine. There are patients too who've tried the machine, I don't like it, etc. You know, what's their comfort level, and then what makes them not like the machine? Is it drying out their, you know, their nose? Is it painful? Is it uncomfortable? So it doesn't have to be the big mask. It could be a smaller mask. It could be what they call nasal pillows that just go into your nose, depending on the severity of your sleep apnea, of course, and you have to be fitted, etc. So if you know, if it's a comfort thing, you know, there is potentially a workaround with that. So that's one way of, you know, opening up that conversation with patients. Another thing, if they're just like, I don't want to be tied to this machine, etc. You know, giving them the health benefits, like, you know, why is it important for them to have this machine, and, you know, getting that restorative sleep that Dr. Nate was talking about, and how important that is. And, you know, you see, and giving them stories, anecdotes of patients who've come in, like Dr. Nathan said, and said, wow, oh my God, I feel so much better. So giving them that encouragement, I think, is helpful too.
Because they can also lose weight, right? Like doesn't it sometimes make them put on extra pounds as well when they are not getting the good sleep with sleep apnea?
Yes.
Correct. And that's because when you're taking a step back, so part of the problem with sleep apnea, and I alluded to this earlier, you don't sleep well because your body doesn't like you getting into those deep levels of sleep because your oxygen level gets low, it stresses the body out. What happens when your body gets stressed? Your body starts
Cortisol.
producing cortisol, which is a
Yep.
hormone that's utilized in stress. And as that cortisol level goes up, fat levels start to rise too, as the body deposits it as a reflex mechanism for when you're stressed. Think about when bears and things are preparing for winter. You know, they try to plump it up so they can survive the harsh weather. And your body is trying to survive the harshness of whatever your environment is by plumping you up, so to speak. So being able to actually sleep makes that cortisol level drop. And subsequently, you can, if you maintain exercise as well, lose some of the weight.
Nice. All right. So let's switch gears a little bit. I want to talk about some of the other sleep issues. I know one of the things that we don't hear enough about, I think, is narcolepsy. Can you guys break down what narcolepsy actually is? Because I think some people say it kind of like in lay vernacular. They'll mention, oh, you must be narcoleptic, but I don't know that people really know what that means. So break down for us, what is narcolepsy? What does it really look like? How do you treat it? Just teach us about that.
Well, it is a sleep disorder. And yeah, when someone says, oh, someone's narcoleptic, what they mean is someone who is having excessive daytime sleepiness, who just falls asleep, you know, at the drop of a dime, right? So they have these sudden attacks of sleepiness, drowsiness that overcomes them. Usually it's related to their sleep cycle. You know, we talked about the 4 stages of sleep, that REM sleep, that restorative sleep, and then the non-REM sleep. Their cycles are off. So usually you go through the first 3 stages of non-REM sleep and then you get into the REM sleep. But with narcolepsy, actually you go kind of immediately into REM sleep. So they just fall asleep suddenly. And there's really, at least I'm not aware of, they haven't figured out what the cause is per se. But you know, there's a lot out there research wise. and there are different types of narcolepsy, and there's some things that help with treatments of narcolepsy too. So it's a rare disorder. Not very many people have it at all, but yeah, that's giving you a little bit about what narcolepsy is.
The classic narcolepsy is precipitated by strong emotional event, and the board word that we use is drop attacks. You know, classic description is someone just gets extremely upset. They maybe scream or they get just and then they pass out.
Oh, wow.
That's your classic narcolepsy. But that's kind of the classic description of what a narcolepsy is. And it could be, some people have them frequently, and some people may have a drop attack once or twice. They typically, when they do a sleep study to evaluate them, they drop into REM sleep extremely fast when you do the sleep studies for them.
Got it. Got it. All right. So let's do a quick roundup for the folks that are watching. So if they want to get a great night's sleep tonight, what's your top 3 things for them to do? Who wants to go first? Whoever goes first probably gets the easiest, because the second person has to find 3 whole new things.
I would say they need to turn off the screen, including their phone. Put down the wine or any other kind of alcoholic drink, and do something relaxing. Just really unwind, whether it's take a shower, read a book, listen to some music, just, really disconnect from the world.
Dr. Nate?
She just kind of took off.
Sorry.
You're fine. You're fine. Other things that you can do that would help, so reading a book, like you said. Some people, I say, play like a board game, something that's not really stimulating, not like a video game where you have to do all the flashing lights, but maybe a board game, doing a crossword puzzle. Grandparents used to use a crossword in the bed before they went to sleep as a way to kind of help, just kind of calm the mind and do something that's essentially not cognitively engaging.
Got it. Awesome. Well, thank you to the both of you for being here and breaking all this down for us. For those that are watching, thank you for joining us. If you want more Black America South content, make sure to hit subscribe down below, as well as the bell to be notified for future episodes. Have a good night, everybody.
Thank you.
Bye. Thank you.